Hi, excited to be here and talk about this. The first thing that I kind of want to talk about is that how social media and healthcare has changed and how that changes the patient. And I've worked in communications for some time now, and I started out in traditional healthcare communications. And about 4 years ago, like many people, we started to see the advent of social networks and blogs changing the way that people thought and the way that they communicated, and particularly the way patients were talking with each other. And in about 2006 is when I made a transition over to social media and digital healthcare as opposed to just traditional communications. And when I first made this transition, I had a lot of flack from a few of my traditional colleagues saying, "What are you doing? That, why would you ever go into this space? This is just a fad. It's going to die down." And so it's fun to see that the writing was on the wall, and that we saw a trend before it was happening, and that the efforts to go into this space and understand it would pay off. I think what's even more exciting is to realize that we can have an impact through social media. I mean, some of the things that you shared today, I was really delighted by, because I do believe that. I believe that we can change the way people think by engaging with them in places that they're willing to share with us. Isn't it remarkable that a person in a blog will talk about a disease that usually they wouldn't even admit to having within their family, and yet among total strangers in a blog, they'll talk about how they feel, the treatments they're using, the embarrassment, the ways that they're trying to get through it. And I believe that as a result, we are helping people, and like Dr. Val talked earlier, that sometimes we're saving lives. So I want to talk about this evolution of how it did happen. It's not just that we've evolved in the sense of that there are new digital tools, but I think the patient themselves has evolved. They have, there's always been the traditional media to disseminate information to the patient. And that was through television and radio and newspapers and magazines, and even further back, the local marketplace is how information would have been given to the patient. But now the patient is becoming the media, and the patient is even becoming the PR or the communications. And so not only have the tools changed, but the patient is starting to participate in that conversation. And as these voices connect and converge, it's almost hard for us to imagine how it used to be. I talked about how just 4 years ago, when I first mentioned I was getting into this new media, there were a lot of people who thought I was crazy. They had always used traditional channels to communicate, and it's really hard even now sitting in this room for any of us to imagine that the patients didn't used to always communicate with the pharmacists or with the government or with any of the public health organizations. But now they have access to it. Now they have access to information that they never had access to, so they get that information and they spread it out among their communities and among their social networks and their friends. And that changes the whole opportunity for everyone, because it's no one-way communication anymore. It's two-way, it's five-way, it's multiple channels. And I think a great point Maya made is that if you don't tell your story, someone else will. And so there's a lot of importance to listening, as Maya talked about, and recognizing where you can jump into the conversation. Your patients have direct access to other patients. And the fact of the matter is, if you don't answer, somebody else will. And I know that sometimes it's scary, especially for organizations or corporations, to engage in this conversation space, because it is the Wild West, and there's a concern that if I get in there, what if something's said I don't want to see, or what if they say something that I didn't want them to misinterpret? But you can't sit like the ostrich with your head in the sand, because the conversations are happening with or without you, and it will continue to happen. And diagnosed people crave knowledge, and especially those who do have access and who do have chronic diseases. Sometimes when you don't feel like you have control, you should go to the only place where you can start to feel like you have control, which is where you can just search and search and search and search, and talk and talk and talk and talk, and rearrange those deck chairs on the Titanic until you feel like you've come to a solution that's going to make you feel better about your situation. And where do we fall into this? We talk about if you don't tell your story, someone else will. Well, how did traditional communications used to tell the story? We used to use media relations, press releases. We'd have a big PR event, or we would even work with grassroots to try to help disseminate our information out. And with the advent of numerous digital tools, these tools didn't just become available to communication folks or PR or journalists. These tools became available to everyone. You do not need to have a degree in order to access a wiki or to start a blog. And perhaps even more frightening, you don't have to sign on to a code of ethics, and you don't have to understand FDA regulations to be able to get out and post whatever you want about a disease state, about a new drug, about how to treat your disease state. And so the patient doesn't necessarily know or think that they are a journalist, although some are becoming more and more aware of their power. And even more specifically, the patient doesn't realize that they are a publicist of sorts and that they are conducting PR, perhaps in favor or not in favor of your particular brand or your organization or your disease state. And as a result, they become a part of this place. But we can use all of these tools also to participate with them and to understand the conversations and to help maybe corral some of the information online. I do believe that most patients have the best interests of heart. They don't recognize the impact of their, or the consequences that are coming as a result of their posting or of their twittering, but they're involved because they care intensely, and as a result they're open to information, and they do want to become more educated. In my last 4 years working in this space, one of the things I did realize is that bloggers do want to be connected with, and they don't mind being contacted. They don't even mind being sent a pitch letter to or even about a particular product, but they do want respect, and they do want you to engage with them on the same level of empathy and excitement and authenticity that another blogger would, rather than just a marketing person or a PR publicist. So, I'm interested to see where we do continue to go with it, but I do underscore the comments of my colleagues here that we can use it correctly, and that social media is going to help us to influence public opinion and behavior. And if we do want to, get our organizations to participate in it and get their head out of the sand and say, I can't engage in it, we just maybe need to help them to understand how to think strategically through this engagement and not to just jump in haphazardly to conversations that are already happening.